Hi, and welcome to Introduction to Clinical and Therapeutic Prescribing. I'm Dr. Bradley McKeown, naturopath, herbalist, nutritionist, educator and researcher. One of the main questions I get asked by students and practitioners is about clinical and therapeutic prescribing. How do they go about it and what is involved? One thing to remember when putting together a clinical and therapeutic prescribing plan is that everyone is unique. Everyone is an individual. There's a lot of family history we need to take into account, such as cardiovascular disease, cancers, osteoporosis, and also genetics and genetic profile. So one of the main conditions that we do see in clinic at the moment is MTHFR polymorphism, which is methylene tetrahydrofolate reductase polymorphism. And what happens in these patients is they have 30 to 60% of the enzyme not properly functioning. They still do metabolize folic acid and other folates, but not as effectively, and we need to take this into account in regards to our therapeutic prescribing. Gender and age. What age stage are they at? And male versus female. We could be looking at estrogen progesterone imbalances. We could be looking at testosterone imbalances as well. Menopause, andropause, and also just general puberty and menarche as well. What age stage they are at. Their current health status and their previous health status. What has happened in the past? Chronic fatigue syndrome, Epstein-Barr virus, cytomegalovirus, Ross River virus, as well as quite a few viruses that play a very big role in chronic disease states. Emotional response. Now, depression and anxiety play a very big role in people's progression through life, and at any stage in life we are susceptible to anxiety and depression. And we are seeing an overabundance of them in clinic at the moment. So we need to look at their emotional response, how they actually respond to treatment as well, and what else is happening in their life. Nutritional status. Are there multiple nutritional deficiencies, absorption issues, metabolism, storage and excretion? So if absorption, a person could have celiac disease, lactose intolerance, Crohn's disease, ulcerative colitis, increased intestinal permeability. All these different conditions play a role in modifying the absorption of nutrients, macro and micronutrients. Medications play a very big role. So the person could be taking a statin, and that can inhibit the metabolism of coenzyme Q10 and utilization thereof as well. Inflammation, oxidative stress play a very big role. Everyone at any stage has inflammation and oxidative stress. But when this increases, it increases their chances of progressing or amplifying chronic disease states such as cardiovascular disease and diabetes. Think about the previous response and adherence to treatment. Are they likely going to do what you ask them to do and plan to do? Because this will negatively affect the clinical and therapeutic prescribing that you're about to do. So keeping all this in mind, we take the case. After taking the case, we determine the short-term and long-term goals. This is based on the patient history, diet and lifestyle factors. At least do a 3-day diet diary or send them away to do a 7-day diet diary. Determine the functions and actions required. Do they need an antioxidant and sort of anti-inflammatory program? Do they need a carminative for their digestive system, adaptogen for their stress, and nervine to strengthen their nervous system? What do they really need? Start piecing and putting this together because it plays a very big role in your therapeutic prescribing. Think of the functions and actions required. Is it acute or chronic prescribing? Is it a cold or flu situation where you might be doing something every 2 hours or every hour? Diabetes, for example, every 3 to 4 hours. Cardiovascular disease, maybe 3 times a day, particularly in the morning. A larger therapeutic window is involved because a higher risk of heart attack and stroke has been found to be in the mornings. Is it a clinical or subclinical deficiency? For example, vitamin C, a clinical deficiency is scurvy, while a subclinical deficiency could be easy bruising, a bleeding nose, particularly when they're not digging for gold. And these play a very big role in working out how we're going to plan the next 2 to 4 weeks, 6 to 8 weeks, 12 weeks and above. Is it a single nutrient or multiple nutrients that we're looking at? Is it vitamin C like I was just saying, or could it be a multiple B complex, vitamin C with bioflavonoids to increase absorption, iron with folate, B12, B6, copper, is there a copper imbalance with zinc? These are all little things that we need to take into account. Activated versus non-activated, there's always a debate on this. I'm going to say to you, take the individual case and work out what is actually required in that person. Because it does, become confusing sometimes with all the information and misinformation out there. So think about what needs to be done and then work out the better absorption patterns, particularly if there's intestinal permeability issues. Think of the synergism of these nutrients. Are they an additive effect or are they inhibiting the effect of each other? So calcium and magnesium work well together, but if the ratio is out, you can cause an imbalance. Zinc and copper improve the absorption of each other, but an imbalance plays a very big role in inhibiting the absorption of each other. Think about cautions and contraindications. Now, there are times when we don't take certain nutrients and medications, particularly with warfarin, so we must take that into account. Review everything after this. So think about the health status, the nutritional status, the age, the diet, the lifestyle, what the patient's already doing, how they're going about what they're doing, what is their daily life like. Find out as much detail as you can. You can get a lot of information in 1 hour. So piece and put everything together, and then think about the short and long-term goals, the actions and functions required, as we're just saying, and then from there you'll see the plan start to come about. My advice is any time along the way that you are thinking about a certain nutrient, it may be zinc or vitamin C for example, write it down, make a note of it, because as we go into the consultation deeper, we might forget along the way. Think about therapeutics. Once we've taken the case, review everything. Think deeply, what else have I missed? Have I missed anything? And then from there, put together the therapeutic plan, write it down, email it, hand it to them, give them all the instructions in written words, not just verbal. That way they can work out the best possible treatment for them. You may need to modify it. But another thing to think about is people don't always remember everything that you've said, particularly if it's a quick consultation. But also they may be highly stressed and confused just generally with the technical information that we're providing them. Please do use technical information and then break it down. Hypertension, high blood pressure, hypercholesterolemia, elevated blood cholesterol. Please use the technical terms because you are educated or you're being educated, and it actually describes the function that you're looking at, because as you're thinking about it, you may think of other functions that you've missed. At this stage, I'd like to say thank you very much for your time. I hope you've enjoyed the introduction to clinical and therapeutic prescribing. More seminars and webinars will be available in the near future. Thank you and all the very best. Please follow me on Instagram and subscribe to this YouTube channel. Thank you and have a great day.